Good evening, wherever you are. This is Alina Park from ConferenceHype. Our segment will focus on negligible impact of parafissural nodules in an AA First Reader workflow from UK lung screening trial. From the 2026 August edition of European Radiology. Background: to evaluate the effect of parafissural nodules on radiologist workload within an AA First Reader workflow for lung cancer screening. Given that AI cannot morphologically classify benign PFNs measuring greater or equal to 103. Methods: 1,250 baseline low-dose CT scans from the UK lung screening trial were analyzed. Results: a total of 1,252 participants were analyzed. Discussion: the impact of typical PFNs on the maximum achievable radiologist workload reduction in an AA First Reader workflow is negligible, with only 1.9% of participants requiring additional radiologist review triggered solely by these benign nodules. From the 2026 August edition of European Radiology. Background: accurate imaging is essential for assessing structural lung abnormalities in children with bronchopulmonary dysplasia. Methods: in this prospective pilot study, infants underwent feed-and-swaddle chest MRI at 40 weeks postmenstrual age and chest CT at 6 months corrected age. Results: 8 infants participated, 7 preterm 28 weeks gestation with severe BPD, 1 term neonate with asphyxia. Discussion: we developed a feasible and safe chest MRI protocol for imaging severe BPD-related lung abnormalities in neonates using a standard 1.5T system. From the 2026 August edition of European Radiology. Background: the objective of this review was to systematically evaluate the diagnostic accuracy of artificial intelligence models for detecting pediatric appendicular fractures on plain radiographs. Methods: this review followed the PRISM-ADTA guidelines. Results: 17 studies met the inclusion criteria, with 11 contributing to the meta-analysis. Discussion: AI models, particularly deep learning architectures, demonstrate high diagnostic accuracy for detecting pediatric appendicular fractures on radiographs, approaching expert-level performance and improving the diagnostic abilities of junior clinicians. From the 2026 August edition of European Radiology. Background: while large language models have shown promise in medical text analysis, their application in automated medical billing code extraction remains underexplored, particularly for the German medical fee schedule system. Methods: following ethics committee approval, we analyzed 499,601 radiology reports from 124,497 patients, containing 1,799,971 manually identified Gaia codes as ground truth. Results: the fine-tuned model achieved an accuracy of 77.15% plus, or minus 0.47%, and a micro-average F1 score of 87.79% plus, or minus 0.31% on the holdout test set. Discussion: fine-tuned LLMs can effectively automate Gaia code classification from radiology reports, with the potential of outperforming commercial LLMs.
This is ConferenceHype. Stay with us, coverage continues.
From the 2026 August edition of European Radiology. Background: prenatal alcohol exposure of the fetus may result in physiognomic alterations and/or impediment of cognitive development, summarized as fetal alcohol spectrum disorders. Methods: for this study, N equals 21 prenatal MRIs of fetuses with PAE and N equals 45 MRIs of fetuses without PAE were included. Results: PAE and non-PAE fetuses were age-matched. Discussion: PAE had no significant effect on signal intensity of the fetal liver, and gestational age-adjusted liver volumes did not differ between fetuses with and without PAE, suggesting no relevant effect on organ development. From the 2026 August edition of European Radiology. Background: to determine if the apparent diffusion coefficient can distinguish acellular mucin from cellular mucin in the treated tumor bed of patients with mucinous rectal adenocarcinoma after neoadjuvant therapy. Methods: this retrospective study included patients with mucinous rectal adenocarcinoma treated with neoadjuvant therapy, followed by restaging MRI and surgical resection or biopsy. Results: of 150 patients, 25 patients had acellular mucin and 125 had cellular mucin at histopathology. Discussion: ADC may be a potential tool for assessing pathologic complete response in mucinous rectal adenocarcinoma after neoadjuvant treatment, after adjusting for acquisition parameters and institutions. From the 2026 August edition of European Radiology. Background: in the last decade, advanced AI methods were applied to radiology, providing tools for clinical practice. Methods: regulations across countries are a relevant topic, considering that AI tools must be regarded as medical devices. Results: we describe the regulatory scenarios in the EU, USA, and China. Discussion: clinical relevance by highlighting convergences across major jurisdictions. This review informs radiologists and developers on safe integration of AI tools, ensuring patient safety, equity, and trustworthy adoption in clinical practice. From the 2026 August edition of European Radiology. Background: this study aims to identify MRI characteristics to better understand the natural course of low-grade central cartilage lesions to promote active MRI-based surveillance as an alternative to invasive surgery. Methods: in this single-center retrospective cohort study, baseline and 48-month follow-up MRIs of 119 patients with a solitary LGCCL of the long bones were retrospectively analyzed. Results: the majority of LGCCLs were labeled as in regression or stable. Discussion: this study on the natural course of LGCCLs of the long bones shows that increasing fat entrapment and/or fat replacement over time on MRI may help prognosticate benign biological behavior and might be supportive for watchful waiting over surgical treatment. This is ConferenceHype. Stay with us, coverage continues. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 August edition of European Radiology. Background: recent insights into understanding intrapancreatic fat deposition and its relationship with common pancreatic diseases have opened new opportunities for their prevention and treatment. Methods: a systematic search was performed in MEDLINE, EMBUS, and SCOPUS databases. Results: a total of 13 studies were included. Discussion: these findings support the suitability of CSC MRI for quantifying IPFD. From the 2026 August edition of European Radiology. Background: infectious spondylolisthesis is a life-threatening condition whose diagnosis remains challenging due to nonspecific clinical presentation, heterogeneous imaging pathways, and variable microbiologic yield. Methods: although MRI represents the diagnostic reference standard, international guidelines diverge regarding the application, role of contrast, use of whole spine versus segmental imaging, and indications for complementary modalities such as CT and FDG, PET-CT. Results, similarly, recommendations on image-guided biopsy timing, number and type of samples, and integration of molecular diagnostic techniques remain inconsistent. Discussion, clinical relevance. This analysis highlights discrepancies among diagnostic recommendations for spondylotisitis, identifying areas where greater harmonization of imaging and biopsy strategies may potentially reduce variability and improve clarity in clinical decision-making. From the 2026 August edition of European Radiology. Background, multiparametric magnetic resonance imaging detects clinically significant prostate cancer with high sensitivity but limited specificity and interreader variability. Methods, we performed a systematic review and meta-analysis of English-language non-RCT studies. Results, 10 studies with 2586 patients were analyzed. Discussion, AI systems perform comparably to radiologists in detecting CS-PCA on MP-MRI, with a potential edge in specificity, though confidence intervals overlapped. From the 2026 August edition of European Radiology. Background, tumor deposits are a negative prognostic factor in colorectal cancer, independent of lymph node metastasis. Methods, patients with histopathological N1 and 2 rectal cancer with and without TDs who underwent curative intent primary surgery between 2013 and 2023 were retrospectively included. Results, 88 patients were included, of whom 27 were excluded due to poor image quality. Discussion, MRI demonstrated limited ability in detecting and differentiating TDs and LNM in preoperative low-risk patients.
This is ConferenceHype. Stay with us, coverage continues.
That's it for now for ConferenceHype's coverage of the August 2026 issue of European Radiology. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.